So when we say, for example, the patient is left hemiplegic. Sabihin, the left side is the one that is affected. So from bed to wheelchair muna namin. Okay. So always remember, if the left side of the body is being affected, you will always place the wheelchair or the chair or the commode on the non-affected side so that the patient can easily move from bed to the wheelchair. But sometimes we cannot avoid, let's say the bed is fixed, nandun. So kung dati mo na siyang pasyente, it's up to you, where you're going to put the head of the bed. Kung saan may pupusin yung head ng pasyente. So pwedeng doon or pwedeng dito, basta ang nakalabas is the good side. So kung nagasa mo na siya na yung bad side na nandito at you cannot move the bed, wala kang nakag-move o hindi na mag-transfer, so nasa discussing mo na yung kung paano mo i-transfer yung pasyente. Ha? Okay. So, let's say the patient is left hemiplegic. So, left hemiplegic, so, dapat doon. So, dapat, kung bago siya pasyente, dito ka magpuso. Para match yung shoulder side niya na dito. So, the patient is left hemiplegic. So, okay, procedure of transferring patient from bed to wheelchair, commode, or chair. So, always, first, if you have to do the beginning procedure, you have to check the doctor's order for the type of transfer you should do to your patient. And then, next is, you can go to the, other than the necessary materials, you have the wheelchair and the guarding belt. And then, after gathering the necessary materials, always we prepare the materials first for the smooth carrying out of the procedure and to save time and energy for the caregiver. And then you can now go to the patient unit, then explain, identify your patient through identification bracelet, name of the patient on the headboard or the foot part of the bed, or if the patient is conscious, you can simply ask their patient's name. Then afterwards, you have to introduce yourself. Good afternoon, ma'am. I'm San Pedro, and I'm here to transfer your assist you from transferring from bed to wheelchair, chair, or commode. And then you have to explain the procedure to gain the patient's cooperation. And then afterwards, again, now wash your hands and then proceed to the procedure. Then take your patient's vital signs before, during, and after the transfer to know if the vital sign of the patient is still stable or if it is elevated. Then next is you can now position the patient. So first is move the patient close to you or okay, move the patient close to you. So, as the patient, so first is the head, then the trunk, and then the leg. And then, if the head of the bed can be elevated, you should elevate the bed to place the patient into a sitting position. Okay, so you have to elevate the head of the bed gradually. So, let's say 5 degrees, 15 degrees, 35 degrees, 60 degrees. So, gradually. And then, upon elevating the head of the bed, you ask the patient, ma'am, are you feel dizzy? So, let's so you have to ask the patient to if it's what you see. But if not, if the bed is, cannot be elevated, so you have to assist the patient in sitting position. So place the wheelchair on the foot part of the bed, 45 degrees. 45 degrees. Okay. So place the patient, place the wheelchair into 45 degrees. So then next is again, if the head of the bed cannot be elevated, so you have to assist the patient into a sitting position. So first step, so you can ask the patient to hold on your head if he can able to do so, and then please support the patient's head and shoulder with your one hand, and then the other one is on the patient's back. Place the head of your patient into the other side, and then always do the private body mechanics. So your one leg moves forward and the other one is backward, and then help the patient in sitting position. Okay, ma'am, at the count of 3, so help me to put you in the sitting position. If the ask the patient to help, if the patient can able to do so. Okay, then leave the patient. One, two, three, go. One, two, three, go. So, okay. Then when the patient is already in sitting position, so you have to wait for 5 minutes. Then ask the patient, ma'am, are you still dizzy? Ma'am, are you still dizzy? Okay. After 5 minutes, after sitting position, you have to wait 5 minutes to avoid the so-called orthostatic hypotension, or it is the sudden increase or elevation of blood pressure upon changing of position from lying to sitting. So when your patient is okay and is still dizzy, so ask the patient to hook by the good leg the bad leg. Hook the good by the good leg the bad leg. So ask the patient to help grab his affected leg and then place it on the good leg. And then ask the patient to lower her bad leg down to the bed. Okay, ma'am? Lower using your strong leg, lower your leg towards or down to the bed. So if the patient can be able to do so, you have to help the patient. And then after that, so ask the patient to scoot towards the edge of the bed. So first is the good side, okay? Put your right side, your right buttocks, ma'am. Put forward. And then assist the bad side. So placing your one hand to the patient's hip, then pull the legs until the patient reaches the edge of the bed. So, or you can lower the bed, but be sure that the bed is locked, the wheelchair is locked. And then after that, next is of course you have to wear the patient's slipper. To me. And then next is ask the patient to place the good leg slightly backward, and then the other one is slightly forward. And then use your one leg, so you have to bend your leg or bend your knees, and then until you feel your lumbar, and then place your one knee against the patient's knee to prevent buckling of the knee. Or you can use the sandwich. So like this. After which do you prefer? Okay, and then afterwards, ask the patient to hold on. Oh, that's talaga. Then ask the patient to hold on your shoulder or on your arm. And then the other one, if can able to do so, but if not, you can allow it to place on the patient's lap or here. And then after that, so place the guarding belt. Okay, and then after this, so okay, ma'am, at the count of 3, release you from sitting to standing. Okay, so 1, 2, 3, go. Okay, so after placing the patient from sitting to standing, again, you have to wait at least 2 to 5 minutes for the patient to gain her balance. So when the patient already gained her balance, then you can now ask the patient to pivot towards the wheelchair. So always pivot on the good side. So the patient will move. Okay, ma'am, please forward your good leg. And then, reaching one leg supporting the bad leg, you should push it. Again, pivot. Backward, the good leg. Then push push the bad leg until the patient reach the wheelchair. And then after that, so you can now ask the patient to hold on the armrest of the wheelchair and then slightly lower the patient's body from standing to sitting position. 1, 2, 3, go. So, and then after that, so when the patient is already in sitting position, so ask the patient again to scoot backward to the back of the wheelchair. Okay, ma'am? Scoot your good the back up backward and then help you push the bad side until the patient reach the back of the chair. And then let us place the footrest. And then place the patient foot to the footrest. So, ganun lang siya kadali. Madali.
Finish time, ha?
And then,